السلام عليكم ورحمة الله وبركاته. معكم الدكتور هشام عبد السلام بن مسعود، استشاري بطب الأسرة، استشاري بطب طوارئ، ورئيس الجمعية الليبية للطب العام. اليوم أود أن أعلمكم بأن الجمعية الليبية للطب العام أصبحت عضو بعضوية كاملة مع المنظمة الدولية لطب الأسرة، وهذا يعتبر فخر لنا ولكم، حيث أنها إنجاز عظيم أن في هذا العام أصبحنا أعضاء بعضوية كاملة داخل هذه المنظمة العريقة. حيث أنها بهذا العام تحتفل بالعام 52 من إنشاء المنظمة الدولية لطب الأسرة، ونحن نفتخر بإنجازنا الذي قمنا به عن طريق الجمعية الليبية للطب العام، حيث بذلك تم الاعتراف بهذا التخصص الموجود بليبيا اعترافا دوليا، وهذه نقطة مهمة جدا وللمهنيين المتخصصين بهذا التخصص بليبيا، تخصص الطب العام. اليوم باسم الجمعية الليبية للطب العام سوف أتحدث على موضوع مهم، وهو بحكم تخصصي كاستشاري طب طوارئ سوف أتكلم على the critical role of defining service delivery package in emergency medicine. This topic is very important. Why? We look to that after finishing the objectives. Firstly, our objectives here is defining the service delivery package in emergency medicine, identify the critical elements in the service delivery package in the emergency medicine, describe the importance of defining the service delivery package, illustrate examples and case scenarios for successing in the emergency medicine, describe the challenges and considerations in the emergency medicine implementations, and describe some examples of success indicators for implementation of the emergency medicine service in this package. Firstly, we need to have some ideas about thinking process for planning. Most of people think the process planning starting with the inputs and then process and outcomes. And this process usually will not fulfill in a proper way. And that's most of the time what happens nowadays. They bringing some inputs and trying to do some processes and trying to provide some outputs. But this situation make the outputs and the impacts on health is not fulfilling our objectives and our strategy on health in our country. But sometimes we need to think differently. Some people thinking process for implementation starting by the output and processes and input. And also this one will not help. Why? Because you should think like this. If you want to do a thinking process, you need to start with the function. And from that, you can define the needs. I mean, the function is the outputs, and the needs is the inputs. So if you then, when you trying to implement, you start from the needs and trying to reach the function. And by this way, it's like a cycle. You need to think about it. Otherwise, you will not helping for solving the issues. So if you're just putting some needs, some inputs, and then try to have a function, usually these our inputs is not in harmony enough to bring the outputs. But if you're putting the outputs and trying to look what's the process needed to get this output, and from these processes, trying to find what inputs you needed. And from that, you can have a good plan, and then you can start with. Why I said that? Because the service delivery package in emergency medicine is need to start with the function, and from that, going to look to the processes, and finally looking to inputs. And when you starting to implement, it's obviously you will need to begin with the inputs, and these inputs, I will talk about these inputs here now. Firstly, all of these components is very important thinking in the emergency medicine or in the service delivery package. First, you think about the level of service delivery, either in the hospital or in the primary care or in the ambulance system and other stakeholders. Accordingly, you understand what kind of function of the emergency medicine will be present there. And from that, you can define this hospital or the ambulance or the primary care, which place allocated with different kind of hazards. For example, if the hospitals are present near to the urban area or rural area or in marine or in deserts or industrial field or in oil field. So all of these different hazards have different needs in emergency medicine. And these things should be prepared for providing emergency medical care to them. And also we should take in consideration about the populations. Some population need specific population need specific kind of emergency medicine, like child, women, men, elderly, disability, and immigrant. All of these need different needs of emergency. Yes, there's some similarity between them, but they have different kind of incidence of diseases for emergency care. So from that perspective, and even if we look into the anatomy for some examples between elderly and children or neonate or infants that have differently, and even the gender emergencies, for example, between men and women, all of these taken in considerations. About the human resource specification lists, for example, what kind of human resource needed, and medicine and supply, physical and infrastructure, equipment, supporting service, all of these should be taken into considerations and put it in mind. And also in the management component, there is a governance, there is a coordination, administration and supervisions, financial management, human resource management, specific information system, pharmaceutical and supply chain management, referral management. So from that, it obviously is a big component of the emergency medicine. All of these domains need to be thinking and taken into consideration when you're trying to planning for putting a service delivery package. What is the critical component of service delivery package? Yeah, it's obviously, for one, the first thing is the functional infrastructures. You need some functional infrastructures between reliable communication system, equipment needed, occupied ambulance and medical facilities. You need accessible roads, you need transporting routes. All of these are very important in emergency care. About the staffing and training, it should be not only staff, you need trained staff, ready staff to providing emergency medicine. We have different kind of staff from physician, paramedics, emergency medical technicians, and other healthcare providers. And in addition to that, you need to readiness about which there's a specific hazard. All of these hazards need specific preparation for care. The training should be considered variable between training, trauma care, or resuscitation training, and also to look for other hazards like poisonings and different kind of hazards like environmental for heat and cold environment. All of these hazards should be taken into considerations. And in addition to that, about medical supply and equipment, taken considerations, drugs, equipment, and other important commodities. We need also to have some protocols and guidelines, which should be clear for managing specific conditions, for example, like cardiac arrest, like trauma, like anaphylaxis. And you should have a treatment algorithm based on the best evidence-based guidelines, and should be visible, achievable, and relevant to our community and our system. If we look into the coordination and communications, should be effective and timely communication during emergency. All of these very important to consider in it. Secondly, we should think about why it's very important to define the service delivery package. The first thing, it's important to define it because you need some sort of standardization and consistency to provide emergency services to deliver the care across different healthcare providers and settings. Otherwise, you don't have a clear guidelines. You need to establish a clear guideline for managing specific conditions, reducing variability in the practice, and reducing also the malpractice. You need resource optimization. Why? Why you need that? Why it's very important to have it? Because it's a specific essential service like testing, treatment, other delivery help us to allocate a resource effectively. If you don't know the function, you cannot know the resource needed, and from that you cannot allocate and optimize these resources according to the needs. Also to prevent unnecessary procedures like testing and admission, optimizing resource utilization. It's very important to do that. For quality improvement, clear package facilitate quality monitoring and improvement. In addition to that, there is some metric related to adherence to the package can be tracked and also lead to a better patient outcome. Patient safety and satisfaction is a very important component, why we need it. As a patient benefit from standardized care, knowing what is expected during their emergency visits. In addition to that, have a consistent service delivery to enhance patient satisfaction and safety. Emergency preparedness. Why you need it during crises like natural disasters, like pandemics, predefined package guide emergency response. It's very important to put it to they ensure a systematic approach even under high stress conditions. Also, we should look to the interdisciplinary collaborations. By defining the package involves collaboration among emergency physicians and nurses, pharmacists, and other team members. And not only that, between different health facility providing services, different level of health facility providing services. It fosters team working and improving communications. We will give some examples and some case studies around the world. First thing about stroke care pathway. In urban hospitals, stroke care pathway streamline acute ischemic stroke management. And the package includes rapid assessment, brain imaging, and thrombolytic therapy, and close monitoring. Why we needed the impact, reducing dirty needle time, improve outcomes, and efficient resource users. And all of that is very important. Trauma triage system. Tire triage system in trauma center define which patient need immediate surgery, intensive care or observation. The impact from that is better resource allocation, reduce overcrowding, and improve survival rates. Pediatric fever algorithm. Community clinics uses algorithms for pediatric fever management. The package includes temperature threshold, clinical signs assessment, and referral criteria. The impact from that, consistent fever management, reducing unnecessary antibiotic use, and improving satisfaction. About the chest pain control and protocol. As an outpatient cardiology clinic implement a chest pain protocol, the package outline a risk stratification, diagnostic testing like the ECG, troponin, and referral criteria, impact efficient chest pain evaluation, reducing unnecessary admissions, and cost saving. So after finishing these examples, we now want to talk about the challenges and consideration during emergency medicine implementation. Firstly, we're talking about the challenge is resource constraints. As we know, the emergency department often deal with high inpatient volumes leading to overcrowding and resource shortage. Balancing limited staff, equipment, and space is a constant challenge. Patient boarding. Patient awaiting admission to inpatient unit boarding can strain emergency resources. Finding solutions to reduce boarding time is crucial. Providing provider burnout. The fast-paced environment, high stress situations, and irregular hours contribute to the burnout among emergency physicians and nurses. Strategy for self-care and support are essential. Interdisciplinary care collaborations, like effective communications and team work between emergency providers, specialists, and other healthcare professionals are critical. Ensuring a seamless transition of care is challenging but vital. Ethical dilemmas. Emergency providers face ethical decisions under time pressure and with limited information. Balancing legal requirement, clinical guideline, and personal value can be a complex. So after that, we will talk about measuring success. When you're talking about measure success, there are some examples like response time, the time from receiving a call to arrival of emergency medical services at the scene, or shorter response time correlate with better outcome. Door to needle time, for stroke example, the time from stroke patient arrival at the hospital to receive a thrombolytic therapy, if eligible, reducing this time improve patient recovery. Patient outcome, survival rate, functional outcome, and quality of life after emergency interventions, metric like 30 days mortality or disability rate. Resource utilizations, like efficient use of staff, equipment, and facility, avoiding unnecessary testing, admission, or procedures. Patient satisfaction, survey of or feedback from patients regarding their experience during emergency care. High satisfaction indicates effective service delivery. Compliance with protocols, adherence to predefined guideline and protocol, monitor whether provider follow established procedures. So all of these are helpful indicators and use it from different countries and different health systems to measuring the service delivery package of emergency medicine. In addition to that, we have some called cost effectiveness, and this is balancing quality of care with associated cost. Cost per life saved or per quality adjusted life years. All of these is very important to consider. Finally, strategically designed service delivery package save lives by ensuring timely standardized care, optimizing resources, allocation, and improving patient outcome. Thank you.